Good morning, all the dental professionals out there, specifically dentists for this video. I want to dip my toe into the clinical world for just a second when you're treatment planning. I learned this a while ago, and I think it was with, who was it? What consultant? I think it was Gary Caddy. And he talked about this a lot. He certainly didn't create this, or I certainly haven't created it myself, but it's been incredibly useful in terms of keeping my schedule full. Number one, always do what's right. If you do what's right, right things will happen. Okay? If it's there, it's there. If it's not, it's not. That's treatment planning. But there's something that takes place when you present it in a certain way, from the patient's perspective. We've all heard this before. Buying, being convinced, it's 80% emotional, maybe even more, I would argue. But you have to present it to a patient in which they can understand, okay? It's PCS, problem, consequence, solution. You're in hygiene, you're doing an exam, and let's see, what can I pick here? You see a cracked tooth. Now I know after doing this for 15 years that that crack is going to do one of two things. It's either going to go in the root or down the root. Those are the two choices it has. It's like a cracked windshield, right? Like, yeah, it's not causing any problems now, but eventually it's going to get to the other side of this windshield. So you identified the problem and you let them know what the problem is. You have a cracked tooth. You let them know the consequence if left untreated. And in this example, it's either going to go in the root, which is going to cause a root canal, and we want to avoid that, or it's going to go down the root. It might get to an area where we can't reach it, and then we have to have the tooth removed at some point. So that's your problem. That's your consequence, and you be quiet. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi. Let the patient talk. If you have a patient that says, well, what do we do? You know that they appreciate your treatment planning and your identification, because remember, that's why they walked into the office. They walked into the office, so if they have a problem, they want to know about it. The second thing that it does is it lets you know that they're ready. Okay, they will find a way to make it happen. But if you have a patient that says, oh, okay, well, great. I'll see you in 6 months for our next cleaning. Like, move on. You can't get better giving patients what they already don't want. So stop. Don't waste your time. I know, as dental professionals, we want to save the world. We want to save every tooth inside our city that we practice. I get it. But it's simply not worth your time, let alone your mental energy. And don't beat yourself up for the patient not wanting what you have to offer, because there's somebody coming behind them that does. And you will find that your schedule will become more full if you use the problem, consequence, solution in your treatment planning. And give it time. It takes time to perfect. It's not always so computerized and robotic, especially when you start having relationships with patients. You get to know who they are. You can say, hey, you got some decay on the side of your tooth here. We better get to it before it becomes more of a problem. Okay, doc, what do we do? You don't have to go down that whole pathway of the consequence and the solution. So yeah, utilize that problem, consequence, solution, and you will find that you'll have a full doctor schedule.